Hi, this is Doug Lott again with a 1.5-year follow-up video on what used to be my glioblastoma brain tumor. I divided this video into part A and part B so that people can view this video in parts. In my first video, I introduced myself and my occupation. By way of review, I am a general dentist who practiced dentistry in Sacramento for about 30 years. I was 60 years old when I had my brain tumor removed. A few months later, I had to give up my dental practice. A lot of things have changed. I miss my staff and my patients. April 2020 is the 1-year mark of my second and last brain surgery for removal of my glioblastoma brain tumor. I was completely paralyzed after my first surgery, except for my right thumb. I could move it slowly. Tears came to my eyes when a nurse told me that if I could move my thumb, I could regain more movement. That was a low point in my life, as you can imagine. My intention for making these videos is to help people avoid getting glioblastoma tumors and support them in case they get glioblastoma brain cancer, and to help people avoid getting cancer in general. My kind of cancer, glioblastoma, has a very poor prognosis. The survival time is less than 1.5 years from diagnosis on average. From Healthline.com, quote, "The median survival time with glioblastoma is 15 to 16 months in people who get surgery, chemotherapy, and radiation treatment. Everyone with glioblastoma is different. Some people don't survive as long. Other people may survive up to 5 years or more, although it's rare," unquote. It is important for you to understand that I am not a cancer expert, nor a cancer researcher. It is also important for you to understand that I can read and understand the epidemiological evidence regarding cancer and the abstracts of most published scientific papers regarding cancer, and that I know the difference between high-level scientific evidence and low-level scientific evidence. I thank God in heaven for science, for published studies, for researchers, and for peer-reviewed journals, and for epidemiological evidence. Together they are creating the how-to guide or map of staying healthy and how to regain health after a cancer diagnosis. I believe I have found enough of the map to get well from my glioblastoma brain cancer. I was starting to have symptoms from my glioblastoma brain tumor in December 2018. January 30, 2019, I had surgery for removal of my glioblastoma tumor. Radiation and chemotherapy followed the surgery. So I can say that I have survived glioblastoma for 15 months. If I died today, I'd be supporting that grim statistic. But I'm not going to die today. Several of my oncologists are surprised to see how well I'm doing. My last 3D scan in May 2020 showed no signs of recurrence. I thank God for doctors also. I could write a book about my doctor visits alone. I thank God I'm living in a country that is very wealthy because of capitalism and has the best medical care in the world. I want to take time to thank the following doctors and medical professionals listed in alphabetical order. The following list of medical professionals is not all of the doctors who have helped me get through this crisis. Nancy Ann Oberheim Bush, MD, PhD, Assistant Professor, Division of Neuro-Oncology, Department of Neurological Surgery, UC San Francisco. UC San Francisco might be the best place in the world to be if you have brain cancer. I think so anyway. Dr. Michael Chan, MD, a board-certified neurosurgeon who did my initial surgery January 30, 2019 to remove my tumor, and then on May 2nd, 2019 did my second surgery with Gleolan. Gleolan is an optical imaging agent that highlights tumor cells. I don't know how to rank neurosurgeons, but from where I sit today, Dr. Chan is on the top of the list. Dr. Gregorius Chrysophagus MD, board-certified hematologist and oncologist, also a board-certified lifestyle medicine physician, as well as being board-certified in hematology and oncology. He believes in treating the patient, not the disease. Dr. Lotfi Hassan Bey, interventional radiologist. He did my cerebral angiogram to make sure my cranial vessels were okay for brain surgery. He suggested I read the book, Meditations of the Emperor Marcus Aurelius Antoninus. All I can say here about this book is that everyone should read this small book. Dr. Stansel Hutchinson, PhD, neuropsychologist, who was testing my brain and reporting to my neurologist. My neurologist, Dr. Khalili, referred me to Dr. Hutchinson. Dr. Nidal Khalili, MD, PhD, board-certified neurologist. I couldn't ask for a more knowledgeable specialist. Neurologists have gone to school many years to understand the brain and nervous systems, and then to know what drug or treatment to prescribe. Dr. Paul Kramer, MD, my PCP for the last about 28 years. Dr. Shirish Mahajan, MD, hematologist and oncologist. He prescribed the chemotherapy agent Timodar to me. Very friendly doctor. Dr. Mike Simmons, my chiropractor, who helped me get through the last 15 to 20 years of my dental practice life. He has a can of WD-40 that he uses to lubricate my cervical and upper thoracic vertebrae. Not seriously. Stephen Bryant Walker, MA, LMFT, and Buddhist Lama, who is helping me to become less anxious through meditation, and because of that, has helped me to become healthier. Dr. Ellen Wigner, board-certified radiation oncologist. She prescribed the radiation treatment. She runs a state-of-the-art radiation facility here in Sacramento. I can't forget her nor her nurse, Marianne. Now, getting back to my reason or intention for making this video, to help you avoid getting glioblastoma cancer or any other cancer and to recover from glioblastoma cancer. If you have cancer, you can do something about your cancer. I'm going to repeat that. If you have cancer, you can do something about your cancer. I personally recommend following every recommendation that your allopathic or conventional oncologist is recommending, like surgery, chemotherapy, and radiation, and then augmenting these Western medicine practices with lifestyle medicine. There is now a professional organization for lifestyle medicine, the American College of Lifestyle Medicine. You can find a board-certified provider in your area by going to the American College of Lifestyle Medicine homepage. Then click the membership tab. You have to enter your name, then you can access the directory of providers. The closest hematologist oncologist to me, who is a board-certified lifestyle medicine doctor, is Dr. Gregorius Chrysophycus, MD. I believe that choosing the right doctor or specialist is key to your healing from cancer. This is perhaps the most important point in this video. You should not have a person in a white coat standing in front of you who can't imagine you getting well. You need to ask a board-certified lifestyle medicine oncologist, what were the risk factors that may have contributed to you getting cancer? Then develop a plan with him or her for recovery. A map, if you will, of how to get well. I want to tell you a short story that I think you'll like. I found it in Ian Gollar's 460-page book, You Can Conquer Cancer. The phenomenon of pointing the bone. The Australian Aboriginal tribes lived in small nomadic groups that thrived amid extremely harsh environments. To survive, they had to have strict rules that everyone generally adhered to. One of the ultimate penalties for a major infraction was the pointing of the bone. If a person broke a major law, they obviously knew that they had broken the law, and when the transgression was recognized by the tribe, the senior people would confer to figure out what punishment was appropriate. And if it was agreed, the pointing of the bone would be carried out by the senior lawholder. The senior lawholder would dress up in ceremonial garb and literally point a human thigh bone at the sinner. There was no beating nor physical assault with the bone. The bone was pointed at the sinner amidst the ritual of the process, along with the words or the curse that the sinner would die. The sinner would immediately go into rapid decline. Then all of the tribe would withdraw and avoid contact with him. Shortly thereafter, the sinner would die. The placebo effect is alive and strong. Your cancer specialist needs to be honest with you and then give you hope for a cure. Or better, as audacious as this may seem, tell you that there is a cure. He or she needs to believe that there is a cure. Words are powerful. If your cancer specialist points the bone at you, find a doctor who gives you hope for surviving. This is the end of part A of this video. When you have time, you should see part B.